call to order the Board of Health meeting. Today is the 10th of February, 2026. We are at 48 Gardner Road, Unit 2 in Hubbardston, Massachusetts. In attendance today, we have Diane Johnson, Judy O'Donnell, and David Rogers, and Sadie is here as well. Our first order of business is to review. We have two passage meeting agendas to review this evening from December 16th as well as the 13th. There is the meeting or the notes from last week, which we'll table to review for our following meeting. So take a couple minutes to read through.
Those minutes were sent to you guys via email, too.
Mm-hmm. Yeah, so thank you.
Wait a minute. Beaver permit, there's only 5 on the board. You've got 4 plus 1 plus 1, that's 6.
The 16th?
3.
Was it December 16th?
Beaver permit,
Just
January 13th. Number 10, B, should be 3.
You said old business? Oh, no, the permit's number 8.
B, 10B.
was
Okay.
4 for it and 1 abstain. Yep.
1
Okay.
abstained, that was
Mhm.
Gael.
Yep.
Gael abstained.
Okay.
Yeah, and under 11B, we're going to have to look at what was voted in for me because of the controversy that was brought up. Let's have to take a second look at it.
So the Beaver permit, it was
3, 4.
3-4.
1 abstained, 1 against.
Okay.
I don't think Gael's particularly fond of that decision.
Did he abstain? I don't recall.
Yes, he did.
He did,
I was
okay.
sitting right next to him.
Very good.
January 13th. December 16th. That was a pretty boring meeting on December 16th.
Yeah. All right. Has everybody had a chance to review them? All right. December 16th, everybody approved that the minutes are good?
I approve.
All right. Judy?
Yep,
All
accept
right.
them.
Yes, I do too. Approved. And then for January 13th, we're just going to amend 10B, the Beaver permit. For the motion was 3 for it, 1 abstained, 1 against.
Okay.
Yep.
And, well, as of that meeting, Judy with the town nurse, but we'll revisit that.
Yes,
Okay.
needs to be revisited.
All right. So with that amendment, will everybody approve?
Yep.
Yes.
Good.
Yes.
Yep, so you can sign those ones and I'll take yours and I'll give you new ones for you to have.
Okay. Thank you. All right. The next agenda item is COVID, flu, and Maven update.
I have no new COVID, no new flu. I do have a Campylobacter again in town, so that I'll follow up with that tomorrow. Judy, if you have anything to add to that,
Nope, not a thing.
okay?
Yeah,
Except
noth-
that we did put out the notice, the reminder about the fact that the people flu season is coming up. Usually it's right around the 14th to the 20th of February. And people need to wash their hands, stay away from people that are sick, and cough into your sleeve. And stay home if you are sick.
Hmm.
So anyway, there's a reminder with some helpful hints about prevention, preparedness, and what to do if you are sick on the website.
Excellent, thank you. Yeah, no new update from the Hubbardson Center School. I'll follow up with their nurse tomorrow and have something to report back. But I haven't heard anything. All right, next item is Title V reports and perk tests. It says NA, but I think we had a couple come in late today. We'll pass around and review.
Let's see what I got. Nope, that's a water test. Okay, so this one is from last week, which is 12 male. She just wanted me to have me double check with Phil that there was no wetlands in the area, so he initialed that and he just marked that.
Oh, I see, he just signed the sticky note just to acknowledge the fact that there are no wetlands.
Mhm.
Okay.
14 Jefferson, there was perk, and wetlands. No, Phil signed the little one, and she wanted the actual big one signed, so he signed them.
Okay,
So
on
that's
the
just to
actual-
review. Yep.
And that was the only thing outstanding on these, right? Was
Yep,
the
just the
signature?
signatures.
Okay. Do we sign these? I can't remember if she signed all
She
these.
does,
She
but
did.
I believe she might have.
Is that her?
No, it would be at the. She might have signed the little one.
Oh, yeah, because we didn't have these, right?
Oh, no, she didn't send it at all. Okay, so then signatures are required, saying to review.
Okay.
So you gotta,
Yep, we'll have to open them up.
Mhm.
All right.
want me to give them to that, to the
Yes,
Christine?
please. this thing again.
You said you reviewed it last week?
So we reviewed the small one, she didn't sign it, but they didn't include the large copies.
Okay.
So she requested the large copies with the signature. Judy.
There we go.
Folds in on itself.
We figured it out.
Very good. So that's 14 Mount Jefferson Road.
Mhm.
Is this the one with the barn across the street, the house on the other side? No, I guess not.
No, I was looking at that too.
It's another big, expensive system.
Is there anything that's not expensive these days?
Not in
That's
the world
crazy.
except as.
Right? Yep. All right, there's that. All right.
All right.
Thank you.
So this is the one that was the split partial. It was just water testing that came in. She wanted the whole folder in there, so that you can see that.
Right to next meeting. Okay. Okay. Gail signed this already?
Mhm.
Was it just not in here?
Nope,
Bring to next
the
meeting.
water testing was just the water testing I bring, and this is the
Oh,
whole.
the whole thing. Okay.
Yeah.
All right, I don't have to read that again.
Water test came back okay?
Yeah, there was no problems with this.
Yeah, Gail
Okay.
reviewed it on the
Last meeting.
Yep.
Okay.
Want it?
No, I mean, it's already been reviewed. I'm good.
That's just me leaving a voicemail.
Right.
Unless there's a question.
Kathy signed that 2 years ago.
So obviously it's been well reviewed.
Right. I don't think we have to go through all this, right? She just
No.
wanted it all
Yeah.
together.
Yeah, she just wanted.
Okay. So, looks like we got the sheets, we got the water testing, right, and then all the permits. Looks like it's all ready to me. Give it to Judy's watchful eye, though. Maybe there's something I missed.
No, she's got more of a Hawkeye than I do.
3 Old
I don't
Princeton
know.
Road. Just water testing.
That's the school.
Hmm?
Is that the school?
No, 8 Elms School, that's next.
Yeah, this is 3 Old Princeton.
Okay.
Let's see.
Just remember I mean, what you put in an email about it.
There is an issue with some iron here. We fail with the iron on this water test right here.
Was there a note sent to them to consider putting filters in?
There isn't, which address was that?
This is,
The Ragged Hill. That's the split property.
yeah, the Ragged Hill.
Yeah, I think, didn't we talk about having them put a filter in?
We did talk about a property having a filter. I just read it here when I was reviewing the,
It was,
it wasn't this one.
One Stop Shop. They had got their filter done and they still had the
Yeah, and then they
magnesium.
bypassed it. and-
Yeah, and it went to the well.
Okay.
So if they haven't gotten a letter with a recommendation for a filter system, then, because otherwise it's going to make their clothes turn
Okay.
yellow. And
Yeah, they're gonna install a softener, so, okay,
Okay.
very good. Yep.
Perfect.
it's not all that healthy over the long run.
Yeah, we had to put in a system, which was fun. See all the results, I just don't see where the actual ranges are.
Take a look at this. Wow, that was a big bill.
Yeah, I'm not sure, Dan, I'm gonna take a look at that. I see all the results, I just don't know what the ranges are, tell if I passed or not. I suppose I could look at a different one. That other company has what the
Yeah.
actual rate, like
The chart of what is, yeah.
yeah,
I think it depends on who's testing.
right.
This is all zeros.
That's what we wanna see.
Yeah,
Zeros are good.
yeah.
That one has a lot of results.
Yeah, it's kind of it's a very specific
Yeah.
wastewater test. Nitrates, alkalinity, ammonia.
Mm.
Um,
Would be nice if they would make recommendations on these reports.
Maybe we can cross-reference this report, because I think these reports have the ranges that it's supposed to fall into.
Well, it does say there's some iron and manganese, duh. But than that, everything else is zero. But I was like you, looking to see what the range was, and it's not on the report.
yeah, there's results, but there's not ranges. So it's hard to compare and contrast.
manganese result is higher than the acute exposure limit. Who's this?
School.
The school. Oh, good.
They should have.
Right, it's supposed to be
they
less,
should have-
less than 1, and we're at 1.1 or 1.31.
They Probably need to just check their filtration system, but that goes back to the Quabbin,
Yeah.
to their facilities management over there.
So I'm kind of unfamiliar what we do in that situation. We have to send them a correspondence to say like, hey, your manganese is out of range. It's actually well above range.
Where is this for the
This is for
elementary
the school, yeah.
Yeah,
Oh,
you want
okay.
to send it back. Lynn Karen is the secretary over there, and Kevin, I can't remember his last name, is the facilities manager over there, so.
We want to compare bring it, table that one to next meeting, and then bring the last month's one
Yeah.
to see what the numbers
that'll
of
be
difference
helpful.
are.
Yeah, that'll work. Let's do
And
that.
then if we need to contact them, we can just send them along an email.
And then
ask them
grab
to-
last month's,
Yeah.
or whatever I have for the past couple months.
So on this wastewater,
The
it
kids
gives,
bringing their own water.
it gives
Mind you.
results, but I'm hoping they're within the acceptable parameters for
And-
wastewater.
And then ask
So
them
we
for the
just
chart.
moved them from
You want me to-
baby bottle to
Yeah,
the-
well, we just need
Water
a
bottle.
reference. It's the Hubbardston Elderly Housing,
They'll be 90 years
3
with the
Old
water
Princeton
bottle.
Road, and it's the
Guaranteed.
wastewater.
Yep.
So we just sort of need the reference parameters. It's a certificate of analysis, but we just need to make sure the results are they're within the normal limits. It's hard to
Right.
say because there's no reference
Yeah.
point.
Yeah, I wouldn't want to approve that because there's
So-
no ranges. A lot of
If it-
results, but no ranges.
Yeah, and it's a wastewater
Right.
test. So we just need to know the ranges, and we are happy to oblige.
Right. You got sticky notes?
Yeah.
Yeah, I need those.
Do you want some? Oh, no.
Yeah, give me some, yeah, just in case I see something, thank you.
Oh, I'm sorry, we can sign this. This is, sorry, I should read the top of it. This is well number 1 tapped prior to the treatment. And then once it goes through the treatment, it's well within range
For the elementary school.
for the
Got
elementary
it.
school.
Yep.
So we're good.
Perfect.
Okay, excellent. Good job, Dave.
So we just need the reference chart for that one, that's fine.
Yep.
Yes, correct.
We reviewed by
Yeah, on this side, right here.
this one?
Yep.
Okay.
That one's difficult to do, too.
All right, so we can cross that off. We do not need to bring anything from Humboldt Center School approved.
All right, so the first one is LAR septic trawler. He actually he bring everything in, I believe. That one, yeah,
Nice. So
Workers'
this,
comp,
we
yeah.
need insurance binders, right?
yeah.
And tonnage?
No,
No tonnage.
that's
A septic hall.
that's yeah,
Oh, septic hall.
yeah, that's residential hauler,
Get you.
and that's if they worked for us previously, they give us what they took from us before.
Okay.
So if they're
So
a
if
new
they're
one,
new, then
they won't have nothing
they'll
because they
have it
never.
next year.
Yeah,
Gotcha.
This company does a lot of business in town.
Septic hauler.
they take the poop.
Great.
Out of Sterling.
Yeah, we always use those.
Yeah.
It's good to have options. This is good. The Hackle Brothers.
Studio Macaroons.
So here's a bunch of ranges, but that was wastewater, was the other one?
Yeah, that was
So we
wastewater.
can compare these ranges.
What is that for?
This is for a basic water test.
Oh, yeah, that one had like nitrate and all
Right.
that.
Are you going to the conference?
Which one?
The MEHB, the Massachusetts Association of Health Boards?
Is that the one at the
Surface
hotel?
allergen.
The conference?
Yeah, that's the one that's mandated.
Is that in
Should
April?
sign as the chair.
Yeah, I believe so.
It just needs 3.
I would like to try to.
Glad you're here.
As long as I'm not
Keep me in
working that
line.
weekend, I'd love to go.
Yeah.
Kathy keeps me in line.
Right?
The one Gael and
And then
Dave
what are
are
we gonna
going
do?
to.
Are they going?
We're out of control now.
If it-
Everybody needs to go.
Yeah, is that the,
Yep. Um,
no, we'll find out.
he's a previous installer.
Are you going?
His stuff just expired,
No, I
He's
did
just
it
doing it
several
again.
years back when
Okay.
I first started on the
and
board.
with the cold
Oh,
weather,
I
I don't think
think
he's
that's the
gonna
one
install
that
yet,
has all that
but-
information that everyone should know about.
Right,
It's coming soon, though.
Yeah, Dave and Gael, we're gonna go, did that
Yeah.
meeting, the NHB
Yep.
meeting in April? You and
In
Gael
Marlboro.
we're
Yeah.
gonna go. As long as I'm not working, I will attend.
Okay, yeah, that's great.
Yep.
if I were on the rolls or down at the hospital, I'd cover your shift for you.
Oh, no, you wouldn't want my shift. Oh, believe me, believe me, believe me. Studio, what do they sell, the macarons, cookies?
Yep.
Cookies.
It's a actual, like, store type thing?
I think,
I think it's just a kitchen and then she sells it.
Yeah.
Oh, gotcha.
Probably retails it someplace else.
yeah, I found them all.
I forget what she makes,
Macaroons?
Macaroons.
Cookies?
Yep.
something more than just macaroons.
Yeah. I bet you they're delicious.
Oh, I bet.
Here you go.
All right, is that everything for the permits?
Yep.
All right, open septic plans, engineering plans to review, we did those from last week.
Mm-hmm.
Excellent. Old business, tabletop exercise, any updates?
Well, I didn't bring it with me,
Did
but
something
have-
have to be signed here?
Oh.
Your old one?
Yeah.
Do you want that?
Did we have to sign that?
Yes.
I did.
Yep.
You
You
signed
put
it?
it in
My little
charge.
scribble.
So Judy, yeah, you,
okay,
let me
I
make
didn't
sure
see it.
Judy signed that one too. 1, 2, 3.
Make sure we
1, 2,
got
3.
3.
Yeah.
All right, and then
And
Judy
Judy gotta
just
sign.
has to sign it, yep.
so, anyway, I now have a policy, an animal care policy.
That one?
Yep. And I now have a functional needs policy to go with opening the temporary
Got it?
shelter policy. And then I also put together a communication policy.
All right, you've been busy.
And I'm not the best policy writer, but I think what I've written will do for them, at least if somebody comes along and edits it. But the other thing that I've done is I have something in the office now. It's a big giant, and it says disaster management on the front. And all of these policies, copies are all in there, along with a whole bunch of stuff. And they're all in alphabetical order. So if I'm not around,
They're in the office,
yep,
in my last drawer.
no, it's right on top,
Oh, in your office.
my office.
Okay.
It's right on top of a box that's filled with a booklet called Tips and another booklet called Shelter Checklist.
And that's where those are,
Yeah.
these here.
Mm-hmm.
Okay.
So I realized that we could have policies scattered all over the place, so I just got a big three-ring binder and I put it in alphabetical order.
Wow.
So there's a table of contents. So that's what I've been working on from the AAR. So that's where we are.
Wow, good job, Judy, this is great.
I
That's a
still,
lot of policies.
we still need to do, I still need to get information about the town insurance policy that was mentioned. We still need to get MOUs for transportation. And Peter needs to get back to me about liaisons to National Grid. And research and establish onboarding process for volunteers. That was for spontaneous volunteers. Because if you're going through the MRC or the CERT, they're already been vetted and quarried and everything else. So let's see, what's it? So we need to set, after, we do have an LEPC meeting coming up, Local Emergency Planning Committee, coming up on April. I think it's the first week of April. So, so that's when the whole board should meet with LEPC, and we can go over any follow-ups, such as the insurance and things like that.
As far as meeting with them, do they come to us? Or do we have to?
We'll meet here, we'll come here.
Okay.
The other thing is National Grid critical customer. That's, I have, because I was doing other things, I didn't track that down, but I will track that down in the next month or so. Radio technician, about halfway through the book. I started practicing for the exam, and I'm hoping that by the end of March I'll have my ham radio license. But I would like to encourage others to think about it.
Wow, that's really neat.
Yeah, well, in emergency situations, when the cell tower goes down, ham radios are very valuable, and can get messages back and forth easily enough. Get a message out, and then on the other end, they can make the phone call if we don't have phones, or we don't have electricity or cell phone or anything like that. So it's good to have 3 or 4 on board. And so, and my father was a ham radio, and I've discovered that I can get his license. So that would be kind of nice.
Nice.
So, anyway, that's kind of my motivation, is to see if I can drum up some business for emergency communications.
I imagine there's some grants and stuff we could probably look into.
Yeah,
Right?
you know, getting a technician license isn't all that difficult. It's only $35 to take the test. And It's fairly easy once you get past the electrical stuff. But, you know, the biggest expense is going to be getting a radio. But one of the things that they say in ham radios, a lot of them now can be portable mobile ones. And they run off of batteries.
Nice.
And you can get yourself a little round antenna. Just set them up, and they'll go on their own.
Wow.
So, but that's what I've been working on over the last month or so. So I circled the ones that we need to do, so we'll keep working at it. Okay?
Excellent, thank you.
There was
So for
an
the-
email that went out.
For those,
From
you did
Pam?
email them? Because I'd like to read through your policies that you spent the time
Yeah.
putting
I
together.
have them on my computer. I'll email them
Excellent, yeah,
out.
if you don't mind emailing me, I'll take a read.
Still,
The other is Pam Masters sent out an very wide Excel sheet. She said that she had taken the 34 responses that, and ours was included in that 34, people that had either done or tabletop like we did, or they participated in Worcester's. I think there were 10 towns that participated with Worcester. So she said she put it out in an Excel sheet. Did you see that?
Mhm.
Okay, I'll forward that then to you as well. I just got it, so I haven't really had a chance to really look at it closely, but my first run through was that there really wasn't a whole lot that we didn't already know. And there also seemed to be an emphasis on folks that chose to do heat as their focus. The heat of the summer is their focus rather than
Rather than the cold of the
cold
winter.
of
right?
winter.
It was one or the other.
Yeah, and we felt that doing the cold of the winter was probably more, we were going to see that more often than we were going to see the heat of the summer. So,
Sure felt like it.
so that's where we're at, and so I'll forward that. I'll forward Pam's, and then you wanted the copies
Yeah, if you don't mind.
of the protocol.
And the items that you just circled on your follow-up items, is there anything that the board needs to take action on? Or are you following up on
Well, it would
that?
be helpful if you could track down the town insurance and also maybe consider what do you want in the MOUs with the transportation, because, and is there anything else that you want added to the shelter? Because you guys are going to be running the shelter. You and the volunteers.
Right.
So if there's,
Yeah, we should probably inventory what's there, what's available.
I know they
there
just,
is,
the water not that long ago.
there is a trailer that is full of all kinds of supplies. Once a year, CERT goes down there and wanders through it. And last year, we tossed out all the water because it was years old. And it was probably good because I have a bottle in my house of water that's been sitting on the shelf for 40 years. And it's still good.
Right, use it for the plants.
Because it's been in a sealed container,
Mm.
you know, and these were sealed containers too. But just on general principles, you know, the CERT team felt that we should probably replace it. But there's other supplies too that we've got to go through. And so we'll set up a date when it's warm
Mhm.
and it's not raining.
Get lots of volunteers.
Right?
So we're not walking through mud.
Mhm.
And that would be good for you folks to join CERT and go through, because there's a lot of medical supplies in there as well.
Okay, excellent. And that trailer's over by the?
Highway Department.
it's all the way down there. And
Mhm.
our shelter is at the,
Right now, it's
The
at the
senior center?
senior center. And that's another thing that we should do.
So we should probably
Is
get it
sometime,
closer.
yeah, we should also talk about having a practice session of setting up a shelter,
right.
bringing down supplies, considering what we need for supplies for initial setup,
Mhm.
and setting up cots.
The senior center has a room available?
They have a large room next to, they have two rooms. One is tables where they have meetings and
Yeah.
cribbage and all that stuff.
Mhm.
And then they have a large room where they have, there's a library there along one wall, and they can do other activities like concert or
Okay.
presentation or something like
Nice.
that. And that's what I'd probably ask Claudia, if we can use that room and set up a practice session for setting up a,
That would make sense.
so
Maybe-
those are the things that I would consider doing in the next 6 months.
So,
Just out of curiosity, they would have, well, I'm sure the place has a capacity done by the fire department already.
Oh, yeah.
We don't want to
Yeah.
overpopulate the shelter.
It could
but-
easily handle 20.
Okay.
We have 24 cots. And when we set it up the last time, we only set up like 5 or 6, and nobody really came down.
Right.
Um,
Yeah.
People either found other ways to stay warm or
Right.
they left town.
Right.
So,
Excellent.
but we could probably set up 12 or so
Okay.
cots and,
It'd be a good dry run.
yeah.
Excellent. Well, thank you, Judy. All right, next order of business, landfill testing update.
there's none, we gotta wait for Gael, so we would table that, and then obviously, yeah, table the Mark Poffin as well.
Okay.
Well, not, just next meeting, if he has update.
All right. Tonnage reports?
Nope, they haven't sent anything in.
Okay, nothing new. So they're like, oh, how come we didn't get approved for Hubbardston?
Yeah. I need you to sign that one, Judy.
Okay.
Discussion of dates for the MPHN.
Yeah, what does that mean?
That was
For, they're supposed to come in, 2 of the staff. is
Oh,
supposed-
yeah.
Yeah, so we're just still waiting.
Wasn't it?
February, no,
The
it's
end
supposed to be
of the
you.
month.
Yeah.
29th,
29?
Yeah.
29.
29.
Is it a leap year?
Auspicious.
No, wait.
It is.
And then, we have the Crenum worksheet that she said if you want to check that, but also the next is for new business is the MRC.
Do we
regional-
want to meet with MPHN?
Well, they're coming here.
Yeah, they're coming here to meet with 2 of the board. Not 3, 2. So we can't have a quorum.
That's the piece that bothers me.
I know. I know.
Were you and Gael gonna do that?
I wasn't gonna.
Oh, initially, they only wanted to meet with Sadie, remember?
Right.
Oh,
Initially,
But
they
if-
only wanted to meet with Sadie.
right, that's good.
And
yeah.
then they said, well, I suppose the chair could be there.
Hmm,
And then there was another note attached to the bottom of the email that said, we don't want the whole board there.
Yeah, it said something about, wasn't there a
Quorum.
A quorum. You couldn't have a quorum of your board
Didn't want it.
because it
Would you-
didn't.
If you're coming
law
in
or
to
something
talk
like
to us,
Right.
So-
I don't understand the policy.
I,
Right.
yeah, I just don't like, the whole thing smells like rotten fish.
But we do give them money every year. So it would be good to
Yeah, and we
justify
gotta
what that
talk
money
about
goes to.
that.
Right. So I
Like,
think
how much
when-
are we getting for it?
Yeah, when we come out of that meeting, I think that's the discussion that we'll have, is if we're getting a return on the dollar from them.
But who's gonna be at the meeting besides Sadie?
Gael.
Yeah.
It needs to be somebody else.
Sounds-
It's always good to have two.
Right.
Never walk into a political or,
Well, we can draw straws, I guess, next week.
What, do they have a firm date on that?
29th, I thought.
I was thinking, I don't remember a date. It would be on the minutes.
Yeah, I think we had it.
Yeah,
Yeah,
I can
the
review
last week in
in
February.
the email as well.
Yeah, it's in the
I
last
know it
one
did
in
go
minutes.
through emails. I don't want to take too much time on that.
It's in the morning. It's like 10.
It was
Is
11
it?
o'clock.
Yeah,
I
oh, yeah.
remember that.
11
Yeah.
o'clock, and it's that last week.
I was thinking.
I want to say it's that Wednesday.
25th,
The 25th?
25th, 11 a.m. We discussed.
I think at least two of the board members.
What day is
meet.
that, Judy? Is that a Wednesday?
It's in January 23rd.
Okay,
23rd is Monday, so it's a Wednesday.
Wednesday, okay. I might possibly be off. If I am, I can make the meeting.
Yeah, I think there needs to be at least two sets of ears.
Yeah, I agree. Ask more questions. Okay, so right now we got the 25th,
And put AI on.
11 a.m.
Good point.
Bring AI.
Okay, I gotcha.
Bring AI.
I gotta put that in the sticky note, because I'm gonna put it on the desk for tomorrow.
Gail, and question mark. All right. New business. It's MRC Regional Protocol.
Okay. That's, every year I send that out to all the boards of health, and every year I send that out to all the EMGs. We cover 22 towns. There's the map. And we're 50% non-medical, 50% medical. So what MA Response is a database that the state supports for folks who are going into MRC, and there's others, other public health volunteer groups that also register with MA Response. So if you had something that was really getting out of hand, you could call one of the other two MRCs and ask for local help, or if you felt that you needed help from a broader base, then you could go into, on the last page is the request form, and you could go into and request for additional volunteers in town. I don't anticipate.
Hopefully we never run into a situation like
Right.
I
That's
know,
what
what
I
kind
was
of
gonna say.
situation would
Jeez.
warrant that?
I'm not sure.
that. Some kind of outbreak.
They did call for wider, when we, 2008, we were, our Wachusett was like barely, we were only 2 years old at the time. And on top of it all, we were victims of the mess ourselves. So other MRCs did come in and help, especially in Fitchburg, where they did get overwhelmed because they had that loss of electricity for up to 3 weeks over there.
Oh. For
So
the
this is
ice
back,
storm.
that was the
Ice storm.
recent, that was the one that they just flooded you're talking about, or this is back
No,
then?
2008,
Okay.
During the
So-
ice storm, they were called in.
yeah.
Because Worcester had it too.
So they, what, 2008?
I don't remember what year it was.
No, they had, it was another year for them. But they, anyway, they did call, other, Lisa Jackson's group from east of 495 came in and helped. So.
Will this
this
also be
is
part of
just-
that binder?
That is just, yes,
The
it's
magic
part of
binder?
the magic binder.
Okay.
So, anyway, that's the protocol. It just tells you who to contact and what their telephone numbers are. Well, Worcester MRC has just recently put Amelia Houghton, or Houghton, I'm not quite sure how to say her last name, as the coordinator. But I didn't put her name on it because she's still trying to get up to speed. So,
Okay.
that's it.
That's good information. Thank you.
And this is just more facts that she gave me for,
Hi, Tom.
Oh,
yeah, I'm like, I can't pronounce it.
Right?
It was good information.
For sure. Yeah.
I included a lot of that in the letter that I edited.
I saw that. That was well written. Thank you. And it sounds like it was received well.
Yes.
I've been in there a couple times, and it
It's
sounds like...
gone now.
Yeah, it's all gone.
They were taking it
Nitrous are
down
gone. Yep.
when Kathy and I went in.
So, that's great.
Yeah, you went with Kathy.
I did, yep, the two of us.
I think as a board, that was a great decision.
Yeah.
Well executed and
Yeah.
well received, too. That's great.
And then we are at turnovers and warrants and
Yep.
only this?
No complaints?
No, not this week.
All right.
It was too cold. The complaint there probably is the snow.
The phone
They
lines
don't
are
got enough.
frozen.
Yeah, they don't got the energy this week.
Right. Right. This is just you.
New business, is that,
That was MRC.
okay, and unexpected subjects? I do know there was some emails that went through, people were looking for, prices on,
Oh.
granola and.
So yeah, so
Oh, yeah.
Katie Young is the Hubbardston Fair, I believe it is. So like people that do stuff that doesn't need to be like fully refrigerated. So what she was asking is, because of last year, she didn't remember what the pricing was or what category they were doing for the food establishments. So
So correct me if I'm wrong, didn't Kathy say that she charges one rate for all?
no, that's inspections. So
Okay.
that's different.
Okay.
Inspections is different. So what it is that when they do like certain fairs, 1-day permits are $20. So those are people that are coming around from everywhere. So that's that. The mobile trucks have their own, but these ones are like specific categories that are not on our pricing list. But they can fall into like certain categories of our pricing list. So there was one which was food mobile truck, which is originally an $80 fee. But if they can provide proof from where they're originally registered, different state, city, whatever, then it goes down to $30. And then, so they're paying the $50 fee opposed to the $80 fee. But then if they're considered an innovation kitchen, which is a full $80, so I looked at the old permits that were issued, and all I seen were $80 fees, but it doesn't say specifically what category they fall under.
Interesting.
So that's a food, because the granola doesn't need to be refrigerated. It's made and then it's
In a sealed bag.
and like certain other items too. And then she was saying the jams as well, are preserved that are no temperature and can stay out. So
And these are for the small vendors that are kind of...
the smaller vendors, yes. So
that sell
that's
that type of edible stuff?
so obviously Kathy would have known because it's the same fairs over and over, but they're not. What I seen were the only $80 ones, unless there was something that I was unaware of that went like differently.
Okay.
Does that make sense?
Yeah. I
Because
did see
we
the
have a whole
email,
bunch of
yeah.
fairs that
So we have to question,
Yeah.
is it $80?
Is that just for fairs, or would that be for anybody in town? Like, so, I'm asking because Ladybug Farm has kind of the same thing. They sell
Jams.
jams and granola and
So-
stuff, and she paid $30.
well, she
Does that fall in the same?
no, because she's considered probably either a residential kitchen or a farm, so she's paying the whole yearly fee.
gotcha.
She's not just paying
Not for the
The
one
one
time.
event.
the event fee.
Yeah.
Jeez, okay. Something I gotta learn.
Okay, we should be
Sounds like we
continued.
need to define it a little bit better.
That's why she told me to ask you guys and then go from there. She just said it was just she just gave me the reference of the granola and the jams.
Okay.
Is that something that we need to reach out to Kathy to get an answer on?
Yeah,
Yeah.
she knows more about this than I
Okay.
do.
Are you gonna do that, or would you like me to talk to her?
Yeah.
Which one, me?
Yes.
Okay.
And you gotta sign off on this one. Oh, you okay? Okay.
Yeah.
Yeah, none of you can write.
Kathy, if
All
you're listening,
scribbles.
shoot me a text.
Well, she won't see this for like 3 days.
Oh, really? Right. I'll talk to her tomorrow. Talk to Kathy about email.
And I have one last thing.
Unexpected subjects, we already went through that, sorry.
I forgot.
All right.
This is just something that I've been hanging on to. Came, and what it is from Instrumental, and it's actually for businesses, and it's actually out of a little booklet called The Empowered Grant Writer. But, and I was hoping to have copies, but I didn't quite get to that today with other things I was doing. So, but it's something that I thought we might look at. We were talking last time we met about setting up an agenda for the year and where we want to go for the year, what did we want to do for the year. And this actually is an outline on how to come to that point. And it's fairly easy to do. It asks, here's some of the questions. It gives you steps, and it starts with, looking at the mission. We do have a mission. And then and then spinning off of that mission. And the final step leads us to actually naming some projects for the year. So,
Yeah, this will help us organize our meeting when we get to setting our goal.
yeah,
Right.
it just looks easy to do.
Right.
And it's in English. That's always helpful, rather than legalese.
Yeah, no, that's good to have.
Do we have a pantry in town, you said?
No, we do not have a pantry in town. You have to go either into Rutland or into Gardner.
Okay, no, this is actually really, really, really good.
Right?
And it actually might help perfect for grant writing so that you have the proposal already set.
Yeah, if you answer the questions and put some real thought into it, then
More
you can
money.
spin off from there.
Right, more money's good.
So I'll send them. I couldn't get my scanner to
Yeah.
work today,
There's a
otherwise I
lot
would have
of
scanned.
opportunities.
Are they all the same?
I have a lot of
grants.
problems
I
today.
think so.
Technology.
No.
Really?
No, it's
So
different.
it's not
Mhm,
just
that one.
me.
Yeah, a lot of my systems.
the beginning of it.
just
Oh.
Yeah, that's what my
Yep.
scanner was doing.
Yeah.
My printer kept shutting itself off, and it never does that, so I don't know what was it.
It's
That's
a
something.
nightmare.
This thing about,
I can keep this?
yeah, I have a copy at home. Going back to the notes, this thing about having two positions at once, of course, I've always kind of worked as a public health nurse. If somebody needed a nurse to go to their home for whatever reason, a home visit, then as a board member and having an RN license, I would take that up and go and make a home visit. So to me, this town nurse thing is just that. If somebody needs a home visit, I have liability insurance, and I have the license, and I have the skills. So as a board member, I'm just more than willing to go out and do that.
So
But if we're going to get into this controversy, whether being appointed as the representative for town nurse, then we need to probably change that. Now,
What was the controversy? I'm sorry.
You don't
I might
know.
have to get
I'm
brought
not
up to
clear
speed
either.
on what the controversy was.
Kathy was made aware, or there was Sadie sent out a message about Kathy being appointed as the
Inspector. Right, within a
Okay,
year of.
but it could be a conflict.
Mm.
It could be a conflict if she was on the Board of Health, of having two positions. We ran into this actually at a town meeting, because the Board of Health at one point was going to hire one of their Board of Health members as the inspector. And the reason why it got shot down at the town meeting is because the Board of Health put it before the town, and then they failed to go to the town meeting and defend their position. And I was actually put on the, I was called by the town moderator that asked if I could speak to it, and I just said I didn't like it. And I gave a whole bunch of reasons as to why you don't want to do that. So, that's where the conflict is can she do it? Well, she's no longer on the board.
Right.
So, and she's not doing it for funds. But the thing is, Kathy talked to the town administrator on her own, and the town administrator is now going to contact the town lawyer. But I didn't get it. I sent an email back and said, why are we contacting the town lawyer when it's the ethics commission that we should be contacting? And a phone call to them is going to save a lot of money, because you know the town lawyers are going to come back with 6 to 8 pages, and with all the
6
whys
to
and
8
wherefores
zeros,
and
right.
the whereases. But anyway, so a call to the ethics commission probably would have sufficed. But now the question is, now that you've done this, all the others are now not school liaison is nothing. That's
Right.
not going to bring on any ethics questions. But if you're going to say that I am the town nurse, even though I'm not getting paid, is that going to bring up an ethics violation? So we may have to alter that.
I see. Okay.
So I just wanted to.
Yeah.
And
mean,
but I go
we'll have
off
to
the
talk through it,
board.
But what I see is that the town nurse isn't an actual,
Paid position.
it's not a paid position within the town, right?
it
You're
would be
volunteering
if-
your services
It would be
if you weren't volunteering.
It would be a paid position if the town would go back and understand that they have already approved and voted on to have a town nurse.
I see. That
And
would be
we've
paid
gone-
per
and we've
diem
gone
if
around
needed,
in
something like
circles.
that.
Which would be different from a
Right, and-
voluntary Board of
and there
Health,
is
a-
like Judy or I,
Right.
And there is a job
There's a difference.
description
Oh, yeah.
for,
very much so.
Yeah,
yeah,
you would
there's
be-
a
you
job
would be-
description for per diem,
That's what I would think it would be.
which,
Yeah.
which would be max of 4 hours a week, and even, you probably wouldn't even need that. I mean, you would be working on little projects that you might do with the children or something like that. As
Oh,
part
if
of,
you-
as part of
if
public
you had to
health.
have a fixed 4 hours a week or something, is
Right.
that what you mean?
And
Yeah.
that person could also delve into Maven, should they have to. They would
Right,
be qualified
exactly.
to handle Maven cases in the town.
Right, she would
as
be a
they
backup for Maven.
arise.
Yeah.
And so it's all approved and ready to go. What happened was Nate was looking at, and the way he reads it is the funds that we were going to use, which is from the Holden Trust Fund, which has been voted on multiple times by the town to be approved, that a portion of it would come to the Board of Health. And majority of it would go for EMS, for their training, for their, to support their EMS system. But, EMS, and it was set up, and the fire department was okay with it because they're getting paid. Every time they do a run on EMS, they get paid. So, anyway, he read it as, and I think I found the papers, but they're down in the trailer. And so we're gonna, they're in some of the paperwork that we were moving from the library to here. And But his point was that we don't deserve it, because it's all supposed to go to the EMS, to the fire department, for EMS. So Board of Health doesn't get any portion of it. If we had followed what the town was voting, the town voted it for several years in a row, that they were comfortable with splitting it. The fire department never argued about it. So all of a sudden, it
And
got
what
taken
fund does
away.
this come out of?
And it got
The
Holden
Holden.
Trust Fund.
Holden.
And all of a sudden, it got taken away from us. Now, we've not been able to find enough paperwork to be able to counter that discussion. And what Nate said was, go back to the court and get the court.
Court. It
Well,
should just be
this
in
was-
the- should
this
just
was
be in
like-
the-
Yeah, this was decades ago.
Oh, okay.
So, because
Is that something they have
the
to vote on
Holden Trust
annually?
Fund got started when Worcester Memorial, bought out Holden Hospital. And then
that's
they
right.
couldn't support Holden Hospital, so they sold it off. But they had made a promise in their contract, when they said that they would support Holden Hospital, they had made a promise that they would, and so they broke their promise, basically. And the court said, well, you have to set up a trust fund. So every town that had patients at Holden Hospital got a certain portion based on the number of patients that took advantage of having their care at Holden Hospital.
Was that just a one-time trust that was set up?
It was
It's
set
probably
up and
been
it's still
diminished at this
going.
point.
It's still in fact going? It's still in fact going?
It's still in fact going.
Wow,
That's a
wow, okay.
impressive trust.
I would like to see all all those funds that were yanked away from us. I would like to see it all come back to us, and then we can fulfill the job description, and we can fulfill the vote that was taken to have a town nurse. And public health, as we demonstrated in COVID, is huge, and it's been neglected for years and years and years. You've got, when I did...
Without
Yes.
having a paid town nurse.
Right. And when
Absolutely.
I just recently got a survey asking about some of the nutritional funds, it was somebody working on a PhD. I filled it out, sent it back to her, but it was on nutrition, and I found it interesting because I did my master's on nutrition and the nutrition programs that they were offering, especially children, and children who are overweight. And I discovered that half of our sixth graders at that time, and I don't think it's changed much, but half of our sixth graders were up over the BMI, the recommended BMI
That makes
at the
sense.
time, half of them.
Hmm.
And then I looked at all the programs, the different programs, to see how successful they were, and none of them were really having really any high kind of success
Impacts,
rate where
right.
you say, yeah.
Right. Yeah, we
Um,
see a drop in the BMI, right?
One of the emails, there was a suggestion that a grant be applied for a town nurse position. Is that something that
Yeah,
could
we
be?
should probably, yeah, I remember that one.
I saw that, and I
Yeah.
didn't know if that was something that could happen.
Yes, I think yeah.
Is that?
Yeah, there's,
It would have an expiration date to
Right.
it,
So just to kind of
So-
summarize,
yeah.
so the town should have a town nurse because it's been approved for years and years and years by the town board, select board. We'd need to figure out whether it comes from the Holden Trust or to go for a grant to pay for it. And then based on what we're going through with Kathy as far as the inspector, it can't be you because it's a conflict of interest. Possibly.
yes.
Which we have to reach out to the ethics committee
Yes, because they're
or
the ones,
the lawyer.
and if they find out, if the ethics commission finds out you know, and says, whoops, and, you know, that's who's gonna come down on your head.
Right, okay.
Dennis,
Well, we have a good
Dennis
summary of
witnessed that
what we
when
have
he
to
was-
look at. I think
Yeah, that's a good
We gotta
point.
talk more,
Yeah, to
maybe
be
when Gail gets
continued.
back, to figure out what our steps are gonna be to make this, to bring this back to the select board, right? No,
Yeah.
Ultimately.
ultimately, once we have our ducks in a row and figure out, we gotta get our hands on the verbiage from this
From the
Holden
Holden Fund.
Trust back decades
Yeah.
ago, I don't know.
I have a little bit of packet of what you guys tabled since before I started, about the nursing. That was tabled for a year before that.
A lot of it, in the
This
last
is an
couple of years, it was
ongoing
tabled
conversation.
just because Nate had said, no, you can't have the money. So it was pulled
Unilateral
out.
decision, all right.
So,
All right, well, we
and
have a
I
good- we
understand
have a
what he
good
was.
structure for the
And I
conversation.
understand what he was trying to, I understand, you know, what his point of view, but I don't agree with it, of course.
Right.
Same.
Just out of curiosity, have you ever done any home visits as
Yes.
the appointed, or
Yes.
we'll put it in quotes?
Yes, yes, there, one in particular, I was there once a week for a long, long
Oh,
time.
wow, okay. So it is a useful,
See, yeah.
it's a needed position.
He had an ulcer, and it was, and I went in, and then I discovered that his wife was diabetic, and then I discovered that they did not have any kind of insurance.
Oof.
So,
It's a good thing that you
so
were
I
there for
was,
them.
I went in there and I tackled all of the issues, and we finally got things under control.
Nice, that's excellent. Nice job. All right. Any other subjects that we would like to cover before we adjourn? No? All right. We shall adjourn. It is 8:12.
Okay.
Thank you.
Thank you.